cases of flu across the country, as well as, and we continue to see COVID cases. The good news is that because of aggressive vaccination campaigns across the country, we have been able to reduce the number of cases that we've been seeing across the nation. And the best news is that we're seeing fewer and fewer patients that need to come into the hospital and be admitted for COVID. And that is a positive trajectory for COVID in this nation. Having said that, people that have medical conditions like hypertension, obesity, heart disease, lung disease are still at high risk when contracting COVID. And so it is important to continue to mask when in crowded situations and to consider, if you haven't been boosted with the COVID vaccine, to do so. The flu has actually been rising quite a bit over the past 2 months. And so we're noticing increasing cases of the flu, not only amongst the adult population, but also amongst the pediatric population. And again, it is the folks, the patients that are most vulnerable, that have suppressed immune systems, heart disease and lung disease, that are being admitted to the hospital following contracting the flu. And those that are being protected, although they might contract other types of infections, are those that are getting vaccinated. So it is very important to get vaccinated for influenza in order to prevent hospitalizations, but also to protect all the other ones that are around you that might be suppressed and might otherwise end up being hospitalized for the flu. And the same thing goes for COVID. So again, while we're seeing improving numbers for COVID, we are seeing rising numbers for flu. And it becomes incredibly important for all of us to use the best intervention that we have right now available in medicine, and that is vaccinations.
All right, wonderful. Thank you so much, Dr. Ellie. And just kind of, can you give us a reminder on what those quarantine protocols are? I feel like we haven't really discussed that in a while. So can you give us kind of a reminder of what that is, just to keep it top of mind?
Sure. Absolutely. So we are still quarantining patients for approximately 7 to 10 days once they've contracted COVID. However, we do have more opportunities for testing and for reassessment based on symptoms. So there is a possibility to cease the quarantine earlier if the symptoms resolve, or if you have if you get a negative test following contracting the COVID vaccine. Contracting the COVID infection. Now, for influenza, typically, if you contract that, the quarantine period is about 48 to 72 hours. But also, we would always caution you to make sure that your symptoms have resolved before going back out into the community.
All right, thank you. That's very helpful. And so kind of, as you know, holiday season is here. Next week or next couple of weeks, we'll kind of be going on for a holiday gatherings and everything. So can you give us kind of an update on what are some common illnesses you may see during the holiday season, and then maybe some steps that maybe people can take to protect themselves from these while they're traveling, visiting family, large groups, everything like that?
Absolutely. I think everyone's really grateful this year that we are able to be with each other, travel more often, and be with our families compared to prior years. And so what we want to be able to tell everyone is that while we are in a position where we can leave our homes and visit our families over the holidays, we want to make sure that we're cautioning everyone that that is still a period when you can contract COVID or influenza. In fact, over the Thanksgiving holidays, we saw a rise in cases across the country following Thanksgiving dinners. And we had many patients admitted to the hospital secondary to respiratory illnesses that were contracted during the holidays. And so just be mindful that if you're not feeling well, if you're under the weather, you have a fever, or perhaps if you have contracted COVID or influenza, to just be mindful of your families and to quarantine yourself. Maybe this is the year that you just postpone a family dinner or a family gathering for another few weeks, or or until the next event, so that you can protect the rest of your family members. Remember, we are seeing escalating numbers of respiratory viral illness in the hospital. I mean, not just amongst adults, but also amongst the children. So we have a rise in the number of children that are presenting to emergency departments and are being admitted, and our hospitals have been full. And so we want to do our best to protect our family members and our loved ones so that they do not end up admitted to the hospital.
That's awesome. Thank you so much for that. And then we have one question from Stephen with Way TV. He had a question for you. So if he is at a holiday gathering with family away from home in another city or state, and he needs pain reliever from over the counter, but he's unable to find any, what is the best action? What's a recommendation that you would have for that situation?
So we understand that in the past few weeks, because of the number of respiratory viral illnesses, that there have been a shortage in pain relievers at your local retail pharmacies. And that the shortage has largely been amongst pediatric pain relievers for children or for infants. You should be able to find some pain reliever or fever reducing medication if you are an adult. But if you are struggling with finding a pain reliever or a fever reducer for a child, I would suggest that before you make the trek out, to go ahead and start calling your retail pharmacies and ask whether or not they have any available. And typically, those pharmacies will be able to direct you to the appropriate location, especially if they're part of a network or a chain.
All right, thank you. Mm-hmm. And then I know you mentioned earlier that hospitals are full right now, and kind of touched on that a little bit. So if someone is sick, if they do have an illness this holiday season, when should they go to the ED versus when they should maybe pursue some alternative care options?
Sure. Sometimes it's really hard to know when you're having an emergency condition that requires the emergency department. But certainly if you start developing slurred speech, weakness, fainting spells, or you're not unable to eat or drink because you're nauseous, you're vomiting, or you have a fever and you have a suppressed immune system, you may need to go directly to the emergency department. If you're having chest pain, go directly to the emergency department. If you've just been in a severe accident, go to the emergency department. However, there may be conditions or situations where perhaps an emergency department isn't necessary, and your visit to a doctor may be delayed by a few hours or maybe a day or two. And this could be if you are feeling under the weather and a little fatigued and you've got a cough or cold. It could also be if you have sustained an injury and you've been hurting for several days but not sure what to do. You may want to start by calling your primary care provider and asking them what the best course of action would be. But if you need to be seen sooner than that, you could always, if it's not an emergency, go to an urgent care center. And urgent care centers actually have they have not only practitioners and physicians that can see you, but they also have the ability to run certain types of tests and to provide certain types of medications. They also can suture isolated lacerations and take care of minor injuries. However, if you are having chest pain or you think you might be having a heart attack or a stroke, those are reasons why you'd want to go directly to the emergency department, and you would not want to delay. And we understand that the hospitals are very crowded right now, and that's why we're making an effort to make sure that people understand that there are other options if they'd like to be seen by a physician. And we want to make sure we're reserving beds and space in the emergency department for those individuals that are having emergencies like those heart attacks and strokes.
All right. Well, thank you so much, Dr. Ellie. Does anyone else have any questions? I'm not seeing anyone raise anything in the chat. It doesn't look like it, so I think we are going to wrap up for today. And just a reminder, everyone, we will be sending a recording out briefly after the ending of this briefing. Thank you.
Thank you very much.
The recording has stopped.